Molecular lab, though, once we actually receive the specimen, we're held to a standard based on when the specimen hits the lab for which that testing occurs. So there is a lot of stuff upstream of that that can impact turnaround time. Things to think about the originating institution, they may be things that you guys are dealing with at your institutions, is how to manage a test if it's a send out. In fact, the volume here at Baylor has reached a volume to where probably in a different financial world of healthcare, we'd have an additional full-time employee who only handles that. But because we don't, we're having to work that in with existing staff. Who receives the orders? Is there one designee to look for these orders, one recipient that all that routes through? And if not, who are the individuals? Who pulls the specimens? If you don't have reflex orders, it's possible that the block has already been put into storage, and depending on the lag time, it could be in remote storage. So who's going to be responsible for that? And then again, we have a regular work day, so how do we work that into the schedule? And if unstained slides aren't already cut, how are we going to get that done and worked into the histology lab workflow? So kind of the recommendation in the CAPAS ICAM guidelines of 2018 was to try to have send outs completed by 3 days of the time it's requested by the provider. And again, the results we're held to in the molecular lab is a 10-day turnaround time. That's 10 calendar days for large panels. So if you sit there and think about, okay, if we take our whole 3 days to send it out, and then it's, a couple days transit, and then 10 days to result, we're already at 11 to 13 days from testing alone, not including maybe the 1 or 2 days it took to get the diagnosis in a perfect world, if it's, say, a procedure on a Monday. But if it's a procedure on a Friday and it's not diagnosed, you can just start to see how all of a sudden you have this huge lag time and a patient on the other end who's not getting treatment until this information is delivered to the provider.